Hi everyone, I'm Samir Lianarachi. So I'm going to talk to you regarding substance abuse and alcoholism. So first, we want to see what is the difference between substance use, abuse, and dependence. So substance use. So when someone consumes illicit drugs, does not always lead to addiction, but there is a risk. So that is called just substance use. Then abuse. What is the meaning of substance abuse? So when a person repetitively consumes illicit drugs regularly despite the fact that it causes issues in their life. So they are repetitively consumes the illicit drugs. So it may be example, example heroin. So if they use it is repetitively, it's kind of abuse. Then what is dependence? Dependence means full blown down addiction. So if they are not getting that drug, their body physical action will be changed. So it will not be tolerable to their body. So therefore, because of that some kind effects, they try to always get the substance. So commonly used substances you can see here, alcohol, commercial names are there, and method of administration in the ingestion, alcohol. These are the health risks: cirrhosis, pancreatitis, and addiction. Then tobacco is the substance, and smoking is the method of transmission, administration, and then health risk: heart disease, lung cancer, and stroke can cause. Then from the cannabinoids, marijuana and hashish are substances. So, marijuana is also called as ganja, and both are taken by smoking or swallowing. So, when we consider the health risk, cough, respiratory infections, and mental health decline and addiction can cause. Right. Then, when we consider the opioids, heroin is one opioid type. So, the morphine, the special medication, is prepared from the same thing, the opium plant. So, these are can be smoked or injected or sometimes swallowed. Health risk due to opium containing substances: constipation, endocarditis, hepatitis, HIV, addiction, and fatal overdose. In high dose, it can cause respiratory suppression, and also, especially if a person get kind of opioids during a head injury, you will not be observe uh, the dilatation of the pupils due to constriction of pupils because of opioids. So then some stimulants are there. Cocaine, you know, uh, can be taken as smoked, injected, snorted. Then amphetamines, especially dexamphetamine, methamphetamine is there. Again, swallowing, smoked, injected. Amphetamines are using for the children with attention deficit hyperactive disorder. And health risk: weight loss, insomnia, stroke, seizures, and addiction. Then specific group called hallucinogens, including LSD, uh, lysergistic acid, can be taken as solo. So health risk: flashbacks, perception disorder can cause. Okay. So why do we drink alcohol? What do you think? So These are the reasons. Sometimes curiosity. They are checking what will happen when we drink alcohol. Then some people drink to reduce stress, and sometimes isolation, sometimes peer pressure to lose inhibition, so kind of things. So these are the effects of alcohol on body systems. So when we consider CNS, psychiatric disorders decrease the sleep patterns, then peripheral neuropathy and some other conditions like Wernicke's and Korsakoff's syndromes and cerebral degeneration, dementia can cause. So you can learn on these conditions. And when you consider the GI tract, esophagitis, gastritis, enteritis, and increased gastric acid production. So number of bad effects, and also even the absorption can be reduced. Vitamin B absorption from the intestines can be reduced. Then when we consider the hematopoietic system, pancytopenia, toxic granulocytosis, elevated mean corpuscular volume can cause. Then when we consider the serious condition, HDL level can be seen in increasing. 1 to 2 drinks per day may decrease the risk of cardiac death. That means small amount. Small consumption may be good, but high consumption cause the bad effect on heart. So vasodilatation can cause decreases blood pressure and reducing blood pressure. Then when we consider genitourinary, modest doses increases sex drive but decrease erectile capacity, testicular atrophy with shrinkage of seminiferous tubules, amenorrhea, decreased ovarian size, infertility and spontaneous abortions can cause with the higher doses. Then these are the other effects. Then here, progressive effect of alcohol ingestion. Right. So this is for 70 kilogram man, 0.01 to 0.05 grams per deciliter can cause euphoria, a kind of elated mood called euphoria, then relaxation and perceived reduction in anxiety. That means smaller dose. Then when we consider 0.06 to 0.1 grams per deciliter, they may face impaired judgment. If they are highly drunken, they will reduce the judgment and can cause more accidents, road traffic accidents especially, and motor coordination will be poor in those people. Increased aggression is also there. And when we consider 0.2 to 0.25 grams per deciliter, they may get sedation. And 0.2 to 0.2 grams per deciliter, memory impairment and loss of consciousness. And if it is more than 0.4, that means 0.4 to 0.6, respiratory depression, coma, or can cause death. So these levels, when we consider, this is for 70 kilogram man, but person to person, these levels will be changed. It depends on the activity of their liver and how the metabolism is going inside the body. So clinical features of alcohol withdrawal, especially patients who take alcohol for a longer period of time, sometimes they get a thing called alcohol abuse. Then they will get a thing called alcohol addiction. Alcohol addiction and finally developing dependence. So addiction or the dependence, when people try to relieve alcohol, they will get symptoms called alcohol withdrawal symptoms. So You can see here, they will get nausea, vomiting, tremors, and paroxysmal sweating. Then anxiety, they will develop agitation, and especially some hallucinations, tactile, visual, auditory hallucinations. They will feel some insects and the animals are walking or disturbing them without any actual sensation. And visual hallucinations, they will see some images, and auditory, they will hear others are talking but nobody actually present. Then they will experience that, and also they will lose their appetite, and they can't sleep properly. They have insomnia and headache or fullness, and also disorientation is a common feature. So they will face these clinical features when they have high addiction and also dependence for alcohol. So what are the treatments? And the first goals of treatment: to reduce the alcohol withdrawal symptoms, preventing complications, and also therapy to stop drinking. So stages: first you have to identify the stage of the patient, then detoxification process, then rehabilitation should be there. Then even after the rehabilitation, you have to provide aftercare. That means you have to be careful, the person may develop the symptoms again. So identification, you have to diagnose the patient. Then detoxification process implies safely separating the patient from the toxic effect of the drug. So the goal is to prevent harmful sequelae such as withdrawal seizures, delirium tremors, and acute psychotic episode can develop. So there should be a proper detoxification method. So you know maybe what is a medication given for the detoxification, especially disulfiram. So it's a medication that given to the people who are highly addictive with the alcohol. When we give them without telling disulfiram, if they use alcohol, they may feel heavy headache exactly, and then gradually they will reduce compensation of the alcohol. So then some other treatment plans are also there, especially naltrexone, block the high you get from drinking, and especially a special medication that especially used in Sri Lanka called chlordiazepoxide and also diazepam. So they can reduce the withdrawal symptoms, and also they are sedatives, especially if the patient has get developed those symptoms. We give chlordiazepoxide as a treatment and reduce withdrawal symptoms. And also thiamine is a good treatment to prevent these conditions. So rehabilitation aims at enhanced function, motivation towards complete abstinence, and prevention of the relapse. So if the person get rehabilitated, so usually they need the counseling and the counseling therapy. So if they get rehabilitated, so usually they will not get further alcohol. But you have to give post care to check their level of rehabilitation. Then here for the aftercare, you have to take the support of the social and economical support, and there should be monitoring, as I mentioned. So then what are the nursing diagnoses? So you see here, one thing is dysfunctional family process related to alcohol. So they have a dysfunctional family process. So family is not in order. The children may be also going for some bad activities. So it may be causing some bad family to the society. Then acute confusion may cause related to alcohol abuse. So they are usually having some confusion due to high consumption of the alcohol, and also risk for impaired parenting related to alcohol abuse. Risk for impaired parenting. So I mentioned that one. Then this is one example incident. Draw a nursing care plan for Mrs. X. So you can try this and create a care plan by reading this. What you can do, how you can address the patient. You can think on this. Then we discussed about the substance used and how it is taken and how substance dependence acts, and what are the actions can be taken as nurses, and what are the medications available. Everything we discussed. So thank you for your participation. Thank you.